All right, here we go. Another dermatology lecture. It is again, just in case this is going on YouTube, it is week 3. It is dermatology. It's the summer of 2020. It's pretty much the same lecture I did for last week 3, the spring of 2020. Maybe a hair different. I'd say 98% the same. More language of dermatology. So we were talking about, what were we talking about? A macule we talked about first, flat lesion, right, less than 1 centimeter. A patch is a flat lesion greater than 1 centimeter. And we talked about, did we talk about a papule, which is a raised little bump that is less than 1 centimeter. And now we need to talk about a nodule, because we didn't talk about anything. What's a big papule called? And this is a big papule, is a nodule. Only it's not really, it's more deep. Well, it's not always, but it's usually more deeply embedded in the soft tissue. It's greater than 1 centimeter. It can be hard or firm. It doesn't have to be rock hard, but it's not squishy and it's not resilient. And those are important terms, because the thing people confuse this with is a cyst. And a nodule can be soft, but it's not boggy or squishy. When you poke into it, it doesn't spring back. And that's what like a lipoma does. It's squishy, and you can roll it and it's boggy. But this is harder than that. Okay, so think of it as an oversized papule or kind of a hard cyst-like thing. But I shouldn't say cyst, because it's not a cyst, like a lipoma is a cyst. Okay, maybe hard or somewhat soft and round. Must have some firmness and roundness to it. Okay, nodule versus a plaque. Well, we talked about a plaque is a raised, but plaques are usually flat-topped. And nodules are not as big usually. Well, they could be about the same size, but plaques don't have a round top. Nodule has a round top. Plaque is more superficial. Nodule is deeper, embedded in the skin. Okay, and nodule versus cyst. So this is an important slide. I always ask you guys about this one. And it's a little confusing. They're both, a nodule and a cyst are both greater than 1 centimeter. They're both fairly round. They both can have some depth. But the cysts, again, have a springy consistency, because they have some kind of a fluid or a gel-like material on the inside, where nodules are rock hard. No, they don't have to be rock hard. They can still be firm, but they don't have that springiness or that resiliency. That means springiness is resilient. They can spring back, right? So make sure you know the difference between those two. There is an example of a plaque. It's flatter. And there's a nodule. It's rounder. These are both greater than 1 centimeter. And the nodule usually has something going on underneath it. Large nodules are sometimes called tumors. But remember, again, nodules don't contain fluid or any semi-fluid like a cyst does. Their surface is round and raised, but it could be warty-like as well. You can have warty-looking nodules, or maybe it has a little crater like a volcano. But usually that's like a classic nodule. All right, the thing is hard as a rock, and yeah, you'd never call that a cyst. Cysts are never that raised. Cysts are also more submerged, I think, than nodules can be. These things were hard, non-resilient, so therefore they're nodules of this patient. It's lymphadenopathy, right? The patient actually had cancer in there. Nodules like papules, they can result from inflammatory filtrates, neoplasms, metabolic deposits. They typically begin down in the subcutaneous tissue or dermis and then work their way up. Are typically deeper than papules or plaques. Perfect example of some nodules would be basal cell carcinoma, a keloid, which is a scar that forms like after piercing your ears. I'll show you pictures of those somewhere through this program. Rheumatoid nodules we'll look at. Xanthomas, so little fat kind of tumors, the plaques can coalesce to form a nodule in this case. There's some keloids right there from someone. She got her ear pierced when she was little. No problem. She tried it again when she got older, and these huge clumps of scar tissue appear. Those are called keloids, but those are nodules. Those are nodule lesions. Here's some classic rheumatoid nodules. I had a patient, was it last weekend with one of this? No, it was the weekend before. An RA patient who showed me pictures of his hands, and they had nodules. Not this bad, but they definitely had nodules. Looked about like this one right here. Basal cell carcinoma. Nasty, nasty. If you ever see a nodule with these types of vein or arteries growing in them, and that's not good. That's called variegation. That is cancer until proven otherwise. Now we go to another thing that's kind of similar to a plaque, because it's a raised lesion. It's definitely bigger than, well, it doesn't have to be, but they're almost always bigger than 1 centimeter. There's no distinction. These things, these can be they can be any size, put it that way. But they usually look like a plaque. But here's the difference. They have fluid inside. Not a pus. It's not a green, yellow junk inside of it. Nasty stuff, because that would be a pustule. But a wheal is filled with a serous fluid, a white type with a little yellow tint to it. Okay, so that's a wheal. That's from an allergic reaction of some kind. It couldn't be a cyst. It's way too superficial to be a cyst. Cysts are more underneath the skin. And if you poked at this one too much, you could actually rupture it. So it's not really, it's so wimpy, it's not even resilient. They are usually slightly erythemic, so it's a little red, right? They're usually pruritic, very itchy as well. And the key with a wheal is they're evanescent, like the singer, right? The Amy Lee of Evanescence. I don't know what happened to them. They kind of a one-hit wonder, I guess. I don't know, that whole album was actually good. But I digress. But that's the key with a wheal. It's evanescent. What does that mean? That means it's going to be gone sometimes within an hour or two. It'll raise up and then it'll disappear. They're definitely gone within 24 hours. Now be careful, because some new ones may come back. So sometimes you have allergic reaction. It may be around for a day or two, but the lesions will not be around for more than 24 hours. We said it's itchy, pruritic, and you can have an outbreak of these things. So here you could see these little ones right here. See, they're starting to coalesce together into this big one. So you can have kind of this rash of wheals. So you have this all over, or over a good chunk of your body, this bunch of wheals, that's called a urticaria. So a rash of wheals, or a whole bunch of wheals, and they don't have to coalesce into one either. They can be all over the place. But that's a rash of wheals is urticaria. That means you have multiple wheals on your body. AKAs for urticaria, lay people call them hives, or urticarial exanthem, because that's the word for rash, right? That's the official word for it, urticarial exanthem. But urticaria kind of gets the message across just fine. If it's only if you only identify one, then it's a wheal. And these all last for no more than 24 hours. Here's a whole bunch of wheals on this kid's face. So he's having he has a urticarial exanthem, or he has urticaria. It's just a bunch of wheals from something he probably ate. There's another one. They're fading away, but they're still kind of lingering. Okay, what are the causes of urticaria? Usually some type of anaphylactic response with histamine has gotten loose in the body, or at least in the regional area. The allergen may be known. You may not know what it is. They may come on for no reason. Stress. My wife has a problem with these things. If she gets stress or before she gets sick, we always know when she's going to be sick, because she breaks out in a rash, and then sure enough, she's not feeling good for a day or two after it. So maybe a virus sets them off. Who knows what the mechanism is? They could be in autoimmune diseases. Early autoimmune diseases, these people have urticaria before the full-blown disease comes out. Cancer is notorious. Her friend, my wife's friend, one of the first signs of her breast cancer was she started getting urticaria for no reason. And she actually had a long battle with it, finally passed away from it. That was terrible. Terrible way to go. Stress reduction, idiopathic. I think we said that. Okay, let's get to our first disease. Not LSD, LSC, Lichen simplex chronicus. Right? Lichen simplex chronicus, LSC. It's itchy rash, basically. It's got some AKAs. Lichen simplex, circumscribed neurodermatitis, I've heard thrown around. Neurodermatitis. Lichen vidal, or LSC. A very common itchy rash. The prevalence, all humans, about 12% of everybody is going to get one of these or has got one of these. The key with it is it's a rash, but it's localized to one spot. Maybe it starts out as a mosquito bite, and you just itch and itch and itch, and pretty soon you got this thing here. Okay, so that's eczema. That's an eczematous lesion. And then the mosquito bite goes away, but it stays. Why does it keep staying? Because you keep scratching it. And you get in this cycle of scratch, causes inflammation, makes it more itchy, feels good. You get some dopamine release from scratching, it feels good. I'm not going to scratch it. Then it gets itchier as it inflames. You scratch it again. Oh, feels good again. You get this cycle, this scratch-itch cycle going, and it's really, really hard to break in some people. Some people don't get this, no big deal, but maybe they're not feeling the intense itch that some people feel. Remember, itch and pain travel down the same nerves for the most part, and some people have way more itch fiber than other people, so some people are more sensitive to itching than other people. But the lesion is described as an eczema. This is one of the eczematous lesions we talked about last week. What is an eczema? What is an eczematous lesion? It's red, it's erythemic, it's itchy, it's pruritic, and it usually is excoriated. That means it's all dug up. It's got scabs, it's got pits, it's got little ulcers from you scratching it. That's what excoriated means. And later it could become lichenified. Remember, that was our word of the day last time. That was our condition last week. Excoriation is, what does that mean? That is a skin erosion or ulcer that was caused by you scratching it too much. An erosion, that means that you just scratched off the epidermis and you didn't get into the dermis. If you scratch so hard that you're actually bleeding into the dermis, you're going to have a scar from that. Fibroblasts will come in from the inflammation that ensues. Okay, sometimes it's called a scab because it crusts over with kind of dried blood serum. So these type of lesions, it's not uncommon for them to be associated with a crust. I guess you could maybe hallucinate a little crust in there on that person. We'll see some more of these pictures. Here we go. So that's definitely got like a crusty thing. You could probably pick that off. But that's eczema. That's an eczematous lesion. Remember, eczema in and of itself is not a disease. Eczema is a lesion finding, a type of lesion that is associated with many types of diseases, including psoriasis, including LSC here. There's a whole bunch of eczematous. The dermatitises, when we talk about contact dermatitises, they present as eczematous lesions as well. Predisposing factors. So this is the big one I put in bold, xerosis. What is xerosis? What is xerosis? Let me stall so I can take some water here. Oh, it says right there what it is. It's dry skin. Everybody gets dry skin when you get older. If you have dry skin at your age, you're going to definitely have dry skin when you get older, and you might have trouble with some rashes and dermatitises and such, eczemas. History of atopy. Did we talk about atopy? I think I did somewhere with all my educating you guys. Atopy means you're allergic to everything. You have chronic sinusitis. You have allergies to cats, spring fever, hay fever. You got a touch of asthma going on. That's atopy. Those people are atopic. Psoriasis, we said that. Stasis dermatitis from DVT or from venous insufficiency. Psychological conditions. People, I usually throw this one on the test because if you haven't watched my slide or lecture, maybe just tried to read the slides to pass the test, you would think, how in the world could psychological condition be related to LSC? Well, like LSD, you can get a kind of a dependence on the high that you feel from scratching, the endorphin release. And people who have anxiety problems tend to be more itchers than other people. People with obsessive compulsive disorders tend to be itchers. And so it is associated with those types of condition. There is a localized neuropathic itch, like neuropathic pain, where they have itch all over the body and it's unexplained. Thought is they just have more itch fiber. And amyloidosis can present with kind of itchy eczemas all over the body as well. Those who are thought, what are we talking about here? Those affected are thought to have, some people seem to be kind of wired for itch. Because everybody doesn't get this, right? I don't get this. You probably don't get this, but there's probably somebody in the room who's had one of these things because they're quite common. And it's thought to be that they have too many itch fibers and they're just kind of wired for that. It'd be great to see a study between Lichen simplex chronicus and people with chronic pain. I've never seen one. That'd be a great study to do. But some people, again, they get great gratification from itching. And there is an endorphin release with that. And it can become habit forming. And you can get into that vicious cycle. Where are the favorite targets of itch? The distal anterolateral leg, scrotum and the vulva, perineum, the private parts down there. Favorite part to develop, to get itch down there. Maybe you could get some tinea crux down there, a little jock itch going on. And some people just itch and itch and itch. And they develop a permanent, it can even become lichenified. The back and side of the neck. So this is where you got to watch out as well because you're going to be treating this stuff all the time. The eyelids from rubbing the eyes. So here's an ankle, here's a heel scratcher. So this guy scratches it at night. He goes, I don't scratch, doc. He goes, no, this is LSC from scratching. I don't scratch. And his wife goes, oh, yes, you do. In the middle of the night, I can feel your foot scratching over there. So you put shoes and socks on him to stop from this. But you can see it's been going on for a long time because he's gotten lichenified, right? Look at the skin. Magnifications have increased. So here's somebody with rubbing their eyes all the time. And it's usually unilateral, but it can be bilaterally if the cause is an itch. And she's got chronic eczema from rubbing her eyes, diagnosed with LSC because it's a vicious cycle. What's the prevalence of this? We talked about the prevalence was high, but some more kind of epidemiology facts. Super uncommon in children, unlike atopic dermatitis, what we're going to talk about. Women are more affected. The peak age is about 40 years. No race, doesn't discriminate, picks all races equally. There's that prevalence, 12%. That's a crazy high prevalence, right? And there's the vicious cycle we talked about. You itch and scratch, causes inflammation, makes it more itchy. You scratch it again, causes more inflammation. You scratch it again. And somewhere in this cycle, the skin is going to start changing, becoming lichenified. And of course, the scratching releases histamines to make you more itchy and endorphins to make you feel good. When the endorphins wear off, your histamine has done the damage, caused more inflammation and itchiness. As we said, it can go on for a long time, and it could cause lichenification. Yep, and we talked about this. Some people can be wired for itch. They've done studies where they've done tissue biopsies on itchers, and they found an increased density of the unmyelinated C fiber, which is one that carries pain as well. And they've also found that they have a decreased threshold. So I don't know how they measured that, but it seems they itch at a drop of the hat. They're just itchy, where other people normally wouldn't be itchy. There's some studies that show a lot of mastocytes. Of course, mastocytes in the area, we know mastocytes release histamine, and they can become wired for pain or for itch. It's a recurrent disease. There's typically a history of it. They've had a battle before for months and months and haven't had a problem, and they get a spider bite or insect bite, and they start itching, and that cycle goes on again. And early on, it's just an eczema, right? Erythematous, maybe a little puffy edema in there, excoriated, may or may not be a little lichenified, but late findings, you can get a permanent lichenification and you've ruined your skin in that area. Here's another heel itcher from chronic itching. That's LSC patient. Here's on the scrotum. Patient had tinea crus or jock fungus, jock itch. And he's been going on for, I think, 8 months. And this is an equal opportunity class, equal sex class, so we have to show the female. A vulval region, labia majoris are lichenified from chronic scratching. You can see a little scratching down on the thighs here as well from some type of fungal infection. They snuffed out the fungal infection, but damage was done. And you'll see this one. Now this one you have to be careful because psoriasis loves to go up in this area. I know several students who finally were diagnosed with psoriasis, and it looked just like this. And it loves here, and it loves down by the gluteal cleft as well. What's the treatment? Put mittens on. You got to stop from scratching, and then eventually things will calm down. You can use topical corticosteroids to help fight the inflammation and itch. Those are great, but don't overuse those things. You can use a topical lidocaine patch. That's right, a pain-relieving patch. Why would that work? Because pain and itch are carried in the same pathways. Another good medication is called clobetasol. It comes in a foam that you can rub on there. That works good. It's not a steroid, but it seems to, you want to try to stay away from. Well, you can use steroids, but you got to be careful with them because they can cause skin damage, as we'll see. And then antibiotics if things get affected. This is a big one here for kids. So LSC usually doesn't happen in kids. This one is more of a kid disease. Some grown-ups get it too, but atopic dermatitis. A lot of docs confuse this and call this eczema, and that is wrong, and I can almost guarantee you the test question is coming where I'm going to call this eczema. Again, eczema in and of itself is not it's not a disease. It's the manifestation of some other disease. Okay, so you shouldn't call that an eczema. You shouldn't call it an eczema dermatosis or an eczema dermatitis. Eczema is the type of lesion. Atopic dermatitis is the disease. Okay, it's pruritic. It's very itchy. It presents as an eczema, so it's going to look like an eczema. It's going to be red. You might have a little bit of excoriation right here from scratching it, and it's going to be itchy. It's an eczema, right? Kids are super common. It's probably half of our kids have had something like this. They all grew out of it. Every single one of them grew out of it. But 25% of all children are going to have. Typically, our kids look just like this, and they all grew out of it. We'll show you some more severely affected, though. But yeah, and this one tends to be on the face of kids. Adults usually don't get it on their face. They get it on their flexor surfaces more. But adults could get it down, like we saw here. They can get it on their chest, kind of, and on their neck here. This is kind of a flexor surface, if you will. Okay, so it's much more widespread, though, than LSC is located to just around the eyes or the ankles or a rubbing area. It is considered a chronic inflammatory disease. It typically begins in infancy and childhood. It's really confusing terms. Dermatologists have been fighting about this. Some just like to call it eczema, and others say no because what about LSC? And so it's just a big mess. The term really came from Wise et al. Back in the 1930s, and it's kind of been with us ever since there. They used it as more of a basket category, kind of like we use eczema, and they threw allergic eczema and a non-allergic true eczema, and we don't even really use these. There's allergic dermatitis we'll look at, but we really don't use these old terms anymore. But it's been around, it's stuck, and some dermatologists don't like it. One big problem that people argue is, call it atopic dermatitis, you think atopy, okay? They must have They must have spring fever, hay fever, have some allergies. But some kids who get atopic dermatitis have no allergies to anything. And so they really don't have any history of atopy. So that's the argument against it. Nevertheless, it's pretty much with us. Oh, are the lawn people coming again? My nemesis is. Okay, so infants and toddlers typically develop this eczema on their face, extensor surfaces. We said that. Adults, flexor surfaces, especially of the hands and the arms, but it can be under the neck in that region we saw already. It's really, really pruritic. It's really, really itchy. So here's a little guy. He's more affected than most people. This is classic atopic dermatitis, maybe a little more severe than normal. This poor little guy's got it really bad. Most kids don't get it this bad, but yeah, that's pretty bad. There's an adult. This one went on the dorsum of the hand, and not really the flexor surface, but it does like to hit the hands. Here's kind of the cracks of the popliteal fossas or flexor surfaces with an adult there. There's another one, and it kind of looks like LSC, but it's way more itchy. And LSC, it's way down here. So you're not going to be scratching the top of your toes, I don't think, without scratching this one. So this is atopic dermatitis. Epidemiology, the prevalence is tripled. We're not exactly sure why, and we're not even exactly sure what causes it. Thought maybe some unknown pollutant in the air that's causing it. There's a genetic component to this. Mom and dad have it. The kids have a chance of getting it. Prevalence is 23% of children, 6% of adults. About 50% of the cases begin within the first 6 months of life. 80% begin within the first 5 years of life. So that's why it's usually a kid's disease. The good thing, like our kids, 70% of those kids go into complete remission by the time they go into adolescence. The kids usually grow out of it. It is often associated, but not all the time, but it's often associated with atopy. And some of the atopic cluster is asthma, allergic rhinoconjunctivitis, where your eyes are red, your conjunctiva is red from allergic, you're allergic to pollen or whatever, and the allergens have went in your nose, and your turbinates are all swollen up and dripping, and that's allergic rhinoconjunctivitis. Hay fever, spring fever. Food allergies. Eosinophilic esophagitis. I think I took that out. I don't think I taught that, but that's just a inflammation of the esophagus that is heavy with eosinophils. It's pretty rare, but that can happen in kids as well. And then most of the time there's a family history positive, but the argument again, some people, there's no history of atopy at all. So it's not in everybody. Pathophysiology, to this day, it's still controversial. Environmental factors are thought to be in play, where some pollutant flowing through the air gets through the barrier of the skin, gets into the dermis and turns on some genes in the tissue down there. And the body doesn't like the looks of it and attacks it in an autoimmune type fashion. So it could be autoimmune related. It could just be pure barrier function related, where normally you wouldn't have that allergy in your skin, but your skin barrier is dysfunctional. We'll talk a lot about that. Flagrant mutations, mutations of tight junctions, those all help with the barrier function of the skin. And if they're leaky, you can get things in your dermis that you're not supposed to, and that can cause an inflammation. So that's really the definition of an irritant contact dermatitis. So that's why some people kind of argue that this atopic dermatitis is nothing more than a contact dermatitis. But nevertheless, this is the way for boards and the way most of the authors describe things these days. Dust mites have been known to get into the skin in people with leaky barriers. So that's another thing that can be tested for. But continued questions is, why does eczema clear up in some people and not in others? Most kids completely get clear of it. Some people battle it their whole lives. And then could atopic dermatitis, could it just be a glorified contact dermatitis, either an irritant or allergic contact dermatitis? And we're definitely going to talk about those. Like a latex allergy, everybody's heard of that. That's a contact dermatitis. That's a allergic contact dermatitis. What about the treatment? The treatment is the same for all of these types of skin lesions, most of them anyway. Emollient therapy, what is that one? Like the beer, Cerveza, CeraVe cream. That stuff works great. Stanford recommended. All my docs are at Stanford, and the dermatologist recommended that. I said, hey, that's what the bottle says, but I always thought that was fake. She goes, no, stuff is awesome, and it's not greasy. And I tried it, and I don't like putting cream on, and that stuff is awesome. It just disappears. It's like it's not even on, and it works wonders for dry skin and when you get little kind of excoriations from cracks in it. If that doesn't work, you go to over-the-counter steroid creams, like this hydrocortisone cream. It shouldn't be more than 1%. They should be usually either 0.5% or 0.75%. There are some from Mexico. There was a paper on this in some of the journals I get that talked about how from Mexico and from China, some 1% hydrocortisone creams were coming onto the market, and they're not supposed to be there. And although if you use it appropriately, that's great, but if you get that stuff in your eyes, you can get cataracts, go blind. Some people are allergic to that. If you keep using it all the time to stop the itch, it'll wreck your skin. It'll make your skin really thin and shiny looking, and it'll never be the same. It's like it's scarred. So you got to be careful with that. Right, so everything I said, it can even cause bruising in the area. All right, that'll do it. So let me know if you have questions. Email me, or you can ask the questions we meet, because I know you'll all watch this, and then we can discuss it at our pre-lecture meeting. See you later.